Unmasking the unexpected, a case of Torsades de Pons and cardiac arrest in a previously healthy young patient. Torsades de Pons is a life-threatening polymorphic ventricular tachycardia that can be caused by an idiopathic etiology when it occurs without any identifiable structural heart disease, electrolyte imbalance, or prolonged QT interval. This diagnosis is made after ruling out all other potential causes. Clinically, the most common symptoms of Torsades de Pons are dizziness, palpitation, and syncope. This case report aims to contribute to the complexity of the presentation of idiopathic Torsades de Pons, clinical profile, diagnostic approach, and the necessity of studies to establish the relationship between premature ventricular contractions and the genetic variants with the onset of ventricular arrhythmias. This is the case of a 25-year-old female with no past medical history who sought medical attention due to recurrent syncopal events. She was not taking any medications, stimulants, or supplements. There was no family history of similar events, cardiomyopathies, or sudden cardiac death. The first syncope occurred in December of 2020 with no prodromes. In the second syncope in February of 2021, she experienced palpitations before losing consciousness, with the episode only lasting a few seconds. In February of 2022, a third syncope occurred characterized by palpitations, dizziness, confusion, diaphoresis, and urinary incontinence. In these events, she showed disorientation with head trauma. Emergency room evaluation for each event showed normal physical exams, electrocardiogram readings, and laboratory values. The patient was referred to a cardiologist for further evaluation. A 24-hour Holter showed premature ventricular complex in a trigeminy pattern, and a transthoracic echocardiogram revealed normal left ventricular size and systolic function with an ejection fraction of 65%. There was also normal left ventricular wall thickness, normal right ventricular size, and systolic function. No findings of significant valve disease. She was later referred to an electrophysiologist and underwent an electrophysiology study, which showed normal intervals and no accessory pathways or inducible arrhythmias. The only findings were sporadic premature ventricular complexes. The patient was started on verapamil and a loop recorder was placed for monitoring. 3 months later, the patient experienced a fourth syncopal event. The loop recorder detected Torsades de Pons and ventricular fibrillation, which you can see in figures 2 and 3. Due to this, the patient underwent an emergent single-lead implantable cardioverter defibrillator for prevention of sudden cardiac death. Further genetic evaluation to identify any underlying etiology revealed variants in the genes PDL-IM3 and SLCA2. Despite the interventions, follow-up appointments revealed over 20 episodes of non-sustained ventricular tachycardia, leading to dose intensification of the antiarrhythmic agent. The patient's overall prognosis improved with the intervention and ongoing care. This case describes a patient with no prior medical history, a structural normal heart, and no electrocardiographic abnormalities typically associated with arrhythmogenic syndromes, presenting with recurrent syncopal events. Despite the use of multiple diagnostic tools, the cause was initially unclear. However, a loop recorder reading yielded the discovery of a Torsades de Pons associated with premature ventricular complex. Previous studies suggest that polymorphic ventricular tachycardia, which can quickly deteriorate into ventricular fibrillation, is often triggered by short-coupled premature ventricular contractions. However, the complete mechanism is not fully understood. In cases where no underlying etiology is clear, further assessment with genetic testing is required. In this case, the patient had alterations in the genes PDL-IM3 and SLCA2. However, their clinical significance remains unclear due to limited literature. This highlights a critical gap and need for further research. This case report provides valuable insight into the clinical profile and diagnostic approach of idiopathic Torsades de Pons, highlighting the need for further studies to explore the relationship between premature ventricular complex and genetic variants in the onset of ventricular arrhythmias. It also contributes to improving our understanding and differential diagnosis in patients with unresolved recurrent syncope. Thank you very much for your attention.